friends, I am Dr. Angshuman Goswami, Senior Eye Surgeon and Consultant with various hospitals in Kolkata, India. I started seeing patients over the last 2 weeks and realized that they have a lot of questions in their mind regarding COVID and how it can affect the eye. I'm going to be answering a few questions that are coming in the minds of the patients regarding COVID and the precautions they have to take to prevent the transmission of virus through the eyes. Does the virus spread through the tears? Well, conjunctivitis as such is not very common due to COVID. In a study, it has been found that it's present in about 0.8% of the patients who are affected by COVID. But yes, the virus is present in the tears. So if one wipes one's eyes with a hanky or a towel and then subsequently somebody else uses it, then definitely they can transmit the infection through these inanimate objects. The other fact is that yes, it can go from the eye to the respiratory passage by means of the nasolacrimal duct. So whenever we have excessive tearing, the extra tear goes into the nose and from there into the respiratory passage. So that itself can transmit the infection from the outside to the respiratory passage. How the virus spreads? It basically spreads the same way as common flu spreads. Hand-to-hand contact, personal contact, or when one touches the face. The other way it spreads very commonly is by sneezing, coughing, and a third method that is very common is through the help of these inanimate objects. So for instance, I have coughed in my hands and then I take hold of this pen. I'm touching the pen and transmitting the virus to the pen. Now once I keep the pen and somebody else uses it, so from the pen again it goes to his hands, and when he takes his hands to his face, he transmits the infection from the pen to himself. So these transmissions are called fomic transmissions. What should I do about my eye appointment? During the initial periods of the lockdown, all the eye OPDs and general OPDs where elective patients were being seen were closed because the government didn't want any kind of overcrowding. But now that the situation is a little better, the OPDs started opening up. But I would still advise that you should come to the OPD if it's really necessary. It's an emergency, or maybe you're not able to sort out the problem through telemedicine, or the doctor advises you that he has to see you in person in the OPD. What care is taken in the OPDs to prevent the spread of infection? Care has been taken at all the OPD points. This is especially done to prevent the spread of infection from any patient to other patients as well as the staff in our hospital. All the patients are screened for presence of any signs and symptoms of COVID, including fever, cough, sneezing or body aches. A detailed history is taken in this regard, as well as any history of contact with a COVID patient in the past 14 days or any history of visiting any country abroad are also taken. What care is being taken in the OPD? All patients who are coming over to the OPD are screened with a thermal scanner for temperature. Their hand is sanitized with the help of a sanitizer at the entrance point, and only one attendant is allowed per patient to come inside. Moreover, wearing a mask is imperative, and keeping a social distance between the patients is also important. So, to prevent overcrowding, all the patients are kept at a distance of about a meter from each other, and the seats in between are kept vacant so that there can be adequate spacing between the patients. As a result, it's always advisable to make a call before coming over to the OPD so that we can plan out our OPD in a fashion that there is adequate spacing between patients and the order in the OPD is maintained without you having to wait for too long. Should I keep my eye appointment if I have symptoms of COVID-19? One important thing to note is that before you come over, you should talk to the reception and tell them if you have any signs and symptoms suggestive of active COVID infection, like fever, cough, sneezing or a running nose. In which case, the reception will help you and guide you to the right healthcare center. What should patients in high-risk group do about their eye appointments? One problem is with the high risk group patients. These are patients who are above the age of 60, those who have other comorbidities like for instance cardiac problem, hypertension, diabetes, and those with immunocompromised state, or patients maybe with cancer. Now these are the very patients who require extra care during this time. Now, I am a retina surgeon and I need to give them monthly injections at times in their eyes. Now at this time what I would suggest is please stay at home as much as possible. You can consult your doctor and maybe discuss out ways by which the injection can be delayed. In case you stay very far away, you can get a vision and an OCT check from a local center and maybe consult me on telemedicine. This is a very trying time and we have to balance between safety in terms of the old patients not getting any COVID infection and on the other side not losing their vision because of neglect. How do I use eye medication safely without touching my eyes? It's not very difficult to put eye drops in your eyes yourself. I'll just show you how it's done. Of course, the first thing that you have to do is hand hygiene. So either you can wash your hands with soap and water for 20 seconds or you can use one of these hand sanitizers which are available. You must go to all the nooks and corners of your hand to sanitize it. Once you find that the sanitizer has vaporized, now you can use your hand safely. Take the eye drop. In this case I am using a tear substitute eye drop. And just turn around. Use it in your dominant hand. You can use the little finger of your dominant hand. Tilt your head a little bit backwards. Pull down the lower lid slightly. Put the eye drop right over your eyes and put the drop. Same way you can do it with the other eye too. In case you have difficulty stabilizing with one hand, you can take the help of your other hand to pull down the lid and put the eye drop with the help of the dominant hand. And of course, if you have somebody at home to put the eye drops for you, best is to lie down and allow that person to put the eye drops directly into your eyes. Should I stock up on eye drops? Yes, it's advisable to stock up on your eye drops, especially if you are suffering from some kind of chronic eye problem, for instance glaucoma or uveitis, where you need to put drops regularly on a long-term basis. This has two advantages. One is that you don't have to, run around to the chemist shop again and again, and therefore prevents exposure to the virus. And second is that the drops may finish at an odd time when you may not find the shops to be open. So it's best to keep a stock of at least 1 or 2 months of the medication that you require for your eye treatment. What should I do about contact lenses? If you ask me, I would abstain you from wearing contact lenses. For one, you tend to take your hands a lot to your face and to your eyes when you try to wear the contact lenses and when you take them off. But one person that you may not be able to live without them for certain eye reasons or for certain social reasons and you have to wear it, I would suggest that you wear it for a very short while. You don't give too much time of contact lens wear so that you don't get irritation in your eyes, dryness in your eyes, and that tends to promote your hands going to your eyes and rubbing your eyes and taking the infection from all around. And in any case, I would suggest that if you do have to wear it, please wash your face and hand properly before wearing the contact lenses and wash your hands properly before taking it off. What should we do about too much screen time? One problem with this lockdown period is the excessive use of screen time. Whether it be on the laptop, mobile or TV, we are stuck onto it. Now, when we do that, We are looking at objects, focusing on it. So we are using our accommodative muscles in excess of what normally we would have done. Secondly, you tend to stare at it. So you stop blinking intermittently, and as a result the eye becomes dry and irritable. So because of all these reasons, the eye may get strained, you may get a headache. So it's very important to take breaks in between. The thumb rule to follow is the rule of 20, 20, 20. After every 20 minutes of work, take a break of about 20 seconds and look at a distance of about 20 feet. Still better if you can just close your eyes and roll your eyes in the closed eyes so that the tear film gets nicely spread over the eye. And moreover, what I would always suggest at this time of lockdown is have some family time. Take off your eyes from the screen and be with your family. Discuss your life, your problems, your happinesses with them. Take home message. Wash your hands a lot. Practice excellent hand hygiene. Keep social distance. Keep your face covered with a mask whenever you're going outside the house. And avoid touching your face, nose, your eyes, because this is how the infection spreads from one person to another. Thanks for listening to me so patiently. Hope this conversation would help you in allaying your anxiety related to COVID, its involvement in the eye and how it spreads. I would be available for consultation at my clinics, and you can call me up on the number given below. I am also available on telemedicine in case you are not able to come over to the clinic. Thank you, be safe and take care.